Well, good morning and welcome to the 5th annual Opioid and Substance Use Disorder Virtual Summit. This is our first virtual summit engaging in a time of crisis. I am in the studio and I am excited about being here, and I am serving my name is Dr. Grenae Dudley, and I'm serving as your mistress of ceremony and moderator for the next 2 days. This is going to be a day full of information and things that we could do to address an epidemic within this pandemic. But before I do that, I do want to give a shout out for all of the folks who have come together to make this possible. Motown Digital, we're in the digital studio of Motown Digital, and I want to say thanks to Mike and Jonathan, John, and Lauren, who have worked tirelessly to make sure that we are Zooming into your homes. But behind the scenes, the folks who have also spent weeks and months really putting it together: Nikki Gable, Tiffany Devon, Darlene Owens, and Zara Dawson. So thank you very much. This opioid overdoses continue to rise in the midst of this COVID-19 pandemic. We need to come together more so than ever to create innovative and equitable solutions and to support each other in a more pressing way than ever before. So I want to again welcome you to the summit. I hope that you spend the next 2 days learning and being energized to go out and to let's do something about it. So without further delay, we're going to welcome Mr. Willie Brooks, who is the president and CEO of DWIHN Integrated Health Network. And it is also my pleasure to introduce Kate Kohn-Parrott, who is the president and CEO of the Greater Detroit Area Health Council. Ms. Parrott was elected unanimously in 2012 as the president and CEO of GDAHC. She is responsible for GDAHC's strategic plan and operation management, ensuring that the organization pursues its mission, vision, and values, providing leadership and guidance to the staff, ensuring member satisfaction and engagement, responding to the members' priorities and ever-evolving health and healthcare's needs of the Southeast Michigan, and maintaining GDAHC's financial well-being. Ms. Parrott championed GDAHC's new strategic plan in 2019, seeking to make health care more affordable for Michiganders, reduce disparities in care, integrate social determinants of health with clinical care, improve health behaviors, and drive positive health outcomes. So without further ado, welcome Kate Kohn-Parrott.
Good morning, Dr. Dudley, and thank you for that warm welcome. Thank you to everyone for being here. We are so excited again to be hosting this very important event. And as Dr. Dudley just mentioned, this has become even more urgent for all of us in the day of COVID, our work around opioid abuse, substance use disorders. And so we're very excited and happy to be here and happy that you're all here to participate in this important dialogue. Thank you to our sponsors. First, let me thank our partner, the DWIHN Integrated Health Network. As Dr. Dudley had mentioned, we have worked together for 5 years, putting this great opportunity together for all of us to have a conversation and to move forward. So very excited to partner again with the DWIHN Integrated Health Network. I want to acknowledge our sponsors and supporters, our associate sponsors, Alkermes, Delta Dental, Orexo, and St. Mary Mercy Livonia. Thank you so much for your support and guidance. And our community sponsors, which are Ascension Health, Beaumont Health, Community Health Awareness Group, GrowthWorks, and Henry Ford Maple Grove Center. And then our table sponsors, Access, Elmhurst Home, Hygira Health, and the Guidance Center. Appreciate all of your support. And as you will see on our screen here, our virtual booth sponsors, the Alliance for Coalitions of Healthy Communities, DWIHN Integrated Health Network, Families Against Narcotics, Fight for Wellness, GDAHC, Mariners Inn, My Care Health Center, the Center for Urban Youth and Family Development, the Guidance Center, U.S. Food and Drug Administration, and Wayne State University Center for Urban Studies. These are important sponsors, and we encourage you and welcome you to work with them and to meet with them in the virtual booths today. They have really put forth a lot of effort to be able to support this important community dialogue, and we most definitely appreciate you supporting them and visiting with them today. So we're looking forward to having a very robust conversation for 2 days, 2 half days. We have some outstanding speakers, as you will see. We have an outstanding agenda. And again, as Dr. Dudley mentioned, I want to thank the efforts of Nikki Gable and Darlene Owen and everyone else who has been really involved and engaged in pulling this together. This is, believe me, a huge, huge effort. And so we appreciate everything that they've done. And we really look forward to working with all of you to come up with solutions for our community. And now it's my pleasure to introduce our partner from the DWIHN Integrated Network, Mr. Willie Brooks, who is the president and CEO of the DWIHN Integrated Health Network. Willie, thank you again so much for your support and your partnership in this important endeavor.
Thank you so much. I appreciate that introduction. Again, welcome on behalf of the DWIHN Integrated Health Network, our board of directors, our leadership team, all of our staff. We all would like to welcome and acknowledge all of you who are participating in this very important conference, to our clinicians, community leaders, family members, peer support specialists, and of course, our providers. Welcome, and we take pleasure in having you in this important event. We're excited to continue this partnership with the Greater Detroit Area Health Council as we lock arms and support. What a fitting title, what a fitting thing, engaging in a time of crisis. We have multiple crises that we're dealing with at the same time. We're dealing with the pandemic of COVID-19. We're dealing with equality and equal rights. We're dealing with economic issues. So we have multiple crises that we're dealing with. And now more than ever, the things that we do are so important and so evident that it definitely causes a change in the lives of the people that we represent. DWIHN has been moving and working diligently to support all of these efforts in this time of crisis. Some of the things we've done is we've successfully expanded our Narcan training program, equipping thousands of communities and law officers and business owners. We also provided disposal methods such as free deterra bags and drug take-back boxes found throughout all Wayne County. We also provided a lot of personal protection equipment to our providers and many of the people that we serve. We know that the only solution is everyone working together to tackle these crises and let us engage in this process. So today we hope to empower you with the knowledge of our diverse panels of experts. I'm looking forward to hearing them speak, but we also encourage you to share your own insights and experience through this virtual conference, which we all are getting so used to now in this era that we live in. So please take the opportunity to visit the vendor booths, to learn more about our providers and resources and all of the different support systems that are out there. Thanks again, and please enjoy the conference.
Thank you so much, Ms. Parrott and Mr. Brooks. Mr. Brooks is well suited for this. He's responsible for 75,000 Wayne County residents with serious mental illness, intellectual and developmental disabilities, and substance use disorders. So we have two dynamic leaders that are working hard in our community to make a difference.